hope we are doing well. My name is Dr. Doris Ndithi. I'm a gynecologist and obstetrician. Today, I want us to discuss ovarian cysts, which are quite common. It's a common condition that I'm sure you know someone who has either been told they have ovarian cysts or you have been told you have an ovarian cyst. So what is an ovarian cyst? When you look at the female reproductive system, we have the uterus and we have the ovaries. Women have two ovaries. Usually in the cycle of a woman or a girl, we find that there's a small cyst that will develop that we call the Graafian follicle, which is going to be about 2.5 centimeters. So that will usually ovulate mid-cycle on mostly if the cycle is 28 days. On day 14, find ovulation taking place, and then now you get an ova that can be fertilized, or the female egg that can be fertilized to form a baby. So when you have an ovarian cyst, it will happen either on the right or the left side. Sometimes they can happen in both ovaries, and it's just a swelling, like you can imagine a small balloon with fluid inside. It's such a kind of swelling that happens on the ovaries on either side. And most of the times, it's harmless. It's just a normal process in the body. So it is harmless. It's not cancerous. In as much as most times when you're told you have a cyst, most women think it is a growth or it is a type of cancer. So they are very concerned and very stressed. But most of the times, ovarian cysts are not cancerous. So they can vary from sizes, from very small cysts to very huge cysts that will make one look like they are expectant. So, and most of the times they are small in size, and they will usually clear on their own. So you find that you don't have to use any medication to treat the cyst. So it will happen, and then within a few months, 1 to 2 months, especially in the women who are premenopausal, the cyst will clear on its own. For postmenopausal women, it's a bit, it doesn't clear so easily. So, what are the causes of ovarian cysts? So, ovarian cysts can happen because of ovulation, number one. So, you find that as a result of ovulation, so you find during the formation of the egg, the female egg, is a cyst that is forming. So at times, if that egg is not released, that cyst can continue growing, and that can cause an ovarian cyst, which is more of a functional type of cyst. Then it can also form in relation to pregnancy. When someone conceives, they form what we call a corpus luteum cyst, and that cyst is the one that supports the pregnancy until the time the placenta takes over the function, maybe for the first 3 months of the pregnancy or so. So you'll find there's a cyst somewhere that is producing the hormones that you need to support that pregnancy to develop. Other causes, we can have common cysts called dermoid cysts. So dermoid cysts, because of the nature of how they develop and the tissues that are involved, you'll find there's a cyst that has a fluid, sometimes very thick fluid we call sebum. Sometimes you may find there's hair inside, or you can even find teeth or bones because of the tissues that are involved in the formation of a dermoid cyst. And it's common in the ages of 20 to 40 years. It is not cancerous. Then you have another cause of cyst that is like if you have a severe pelvic infection that forms an abscess. So that abscess can appear as a cyst on ultrasound, but then you'll be told you have a cyst, but of course there will be other features that will be picked to show, and also depending on how the symptoms that you have will be formed if it is an abscess. The others, you have patients with polycystic ovarian syndromes who have multiple ovarian cysts on the ovaries. Usually, the ultrasound will be able to show the number of cysts, and there's a criteria we use to decide that this one is polycystic ovarian syndrome or it is not. So polycystic ovarian syndrome is one of the causes of ovarian cysts. There's some patients who have endometriosis. Endometriosis is a condition where the endometrium The endometrium that sheds during menses implants elsewhere in the body, outside the uterine cavity. So when you find endometrial tissue attaching on the ovaries, you can end up with what you call an endometrioma, where you find like blood sheds inside the cyst, inside, and then every cycle blood is shedding in. Sometimes it dries up, so it appears like a cyst on ultrasound, and this condition is usually very painful. Especially, you will get very painful periods. Then you can also have pain at other times. Then another cause of cyst is cancer, ovarian cancer. And ovarian cancer is as a cause of cyst, you'll find there are other features that will happen. It will not just be a cyst and then no symptoms. Usually you may find you have symptoms of bloatiness, or you feel like you have a lot of gas, or you have symptoms of abdominal fullness, or your tummy swells up very fast, it fills up with fluid, or you find that when you're eating, you get what we call early satiety, or you eat something small and then you feel like you're already full, among other symptoms. So, but your doctor will usually explain to you all this, because the diagnosis usually will be made, and of course, in consideration with the symptoms that you have and the investigations that are done. So, what are the symptoms of ovarian cyst? One, you need to know that most ovarian cysts are symptomatic. You don't feel anything. There is no symptom that you have. And sometimes, actually, it's a coincidental finding when you are going for investigations for other conditions. So when you get symptoms, then you'll get maybe pain. It is usually on and off. It can be on the right or on the left, depending on where the cyst is, on the lower abdomen. And the pain can be sometimes severe, sometimes just some dull pain that is neither here nor there. Then you can have pressure symptoms, like you feel like your pelvis is full, or you feel like there's something that is weighty inside the pelvis. Then you can also have symptoms like uh, um, when you have what you call torsion, ovarian torsion, or the cyst undergoes torsion, then you get very severe sudden onset pain that is so severe that you cannot ignore it, and most of the times you have to go to the hospital. This pain can happen in association with nausea and vomiting, sometimes fever, and the area becomes very painful even to touch. So those are some of the symptoms of cyst. Of course, if there's maybe cancer or polycystic ovarian syndrome, the symptoms will be different in relation now to that condition that has caused the cyst. So generally, these are the symptoms of ovarian cyst, but remember that most of them are actually asymptomatic. What are some of the investigations that can be done to ascertain whether you have a cyst, and if you have a cyst, what is the type of the cyst and all that? The one investigation that is done is an ultrasound, a pelvic ultrasound. The pelvic ultrasound will show the side where the cyst is, whether it is right or the left, and the size of the cyst. Then it will also show what is inside that cyst. Is it just fluid, so that it's just a simple cyst, or there are other solid components inside that will tell you this is not, it's a more of a complex cyst. Then it will also show you if there are any other issues within your abdomen. So a pelvic ultrasound is good. Sometimes it is done, you have what you call, the doctor may recommend what you call a transvaginal scan, so that they can clearly pick the features of that cyst. Then depending on what the ultrasound will show, the doctor may recommend either you have a CT scan or an MRI, depending on the cyst that is seen on the basic ultrasound. At times you may have pregnancy causing a cyst, so the doctor may request for a pregnancy test. And sometimes we've had patients with ectopic pregnancies who are diagnosed to just have a cyst, but based on the symptoms that you present with. And so the doctor will examine and guide accordingly. Sometimes the doctor will see a cyst and suspect it could be ectopic and send you for a pregnancy test. So you may find yourself having a pregnancy test. Then there are some patients, especially the ones who are post-menopause, you'll find if you have a cyst, the doctor wants to check if it could be cancerous or not. So they may send you for what we call tumor markers, CA125, to try and see if the levels are in keeping with what, of course, in consideration of all the other features, if the levels are high to warrant concern for malignancy or cancer. So there are many tests that are done to ascertain whether the cyst you have is just a simple cyst or it is a cyst that is more likely to be cancerous, because that is very important, because that dictates how management is done. So if you have been diagnosed with a cyst, then what kind of treatment will you require? Most times, cysts, patients with ovarian cysts require no treatment, and especially if they don't have any symptoms, they will require no treatment, depending on the features that the cyst is found to have on ultrasound, and depending on the other considerations that the doctor has put in place. So most times we find it's just a simple cyst, which is as a result of the normal physiological functioning of your body. So you find that you don't need any treatment. And then the doctor may give you like a follow-up program where maybe you need to repeat the scan after 2 or 3 months to try and see if the cyst is growing or it has reduced in size. And if it is growing, is it something of concern or is it changing in terms of the features? So the doctors will usually tell you whether you need that regular follow-up or you don't need any kind of follow-up. So most of the times the cyst will resolve within a month to 2 months. And especially in the premenopausal women, the cyst will tend to resolve. Then the other treatment that you can be given, the treatment that you can get is if you have pain, you can be given painkillers. That will also help with the inflammation that can happen, especially if there's some bleeding in the cyst causing pain. So you can get painkillers. If you have, maybe you've had recurrent cysts, you're having cysts every time you're investigated, then the doctor can put you on pills, oral contraceptive pills, to try and like rest the ovary so that you don't form any more cysts. So maybe for a month or two, you'll be put on the pill, just to prevent formation of new cysts as the one that you have resolves. Then the other treatment that you can get for cysts is surgery, and there are some patients who will require surgery as compared to the other kind of management. So these are patients who have maybe a cyst that is suspicious for cancer. So those ones will need further investigations, and most of the time they'll end up with surgery. Then patients with a cyst that is causing them a lot of pain that is not resolving despite the treatment that they are given. Patients with cysts that are huge, like a cyst that is more than 10 centimeters, has a high risk of undergoing torsion, so they may require surgery to remove the cyst. Patients who have other features of ovarian cancer, so you have a cyst, but you have other features of ovarian cancer, either based on the symptoms you have or on the ultrasound or any imaging that has been done. They may show that you have features of ovarian cancer, so these ones will require surgery. Patients who have ovarian torsion or because the cyst is on the ovary, it can grow big and then it is heavy, so it undergoes torsion where it twists on its attachment. So when there is twisting, then there is no blood flow to that cyst or to that area. So that area tends to die off, and then it causes very severe, sudden kind of pain, and it's the kind of pain that you cannot ignore. So that torsion is an indication for urgent surgery. So when you go for surgery, you may find depending on availability of the surgical technique and also the kind of cyst you have. There are some will go for laparoscopic surgery where you will just have small holes, like 3 holes on the abdomen, so that the doctor operates using a machine and they don't have to cut and give a big wound. Or there's some people will require open surgery, especially if the cyst is suspicious for cancer, or in an area there where you cannot access laparoscopic surgery and you really need to have surgery. So you may find it's either laparoscopic or done open surgery. And then the type of surgery that will be done will depend on the type of cyst. For simple cyst, you may find the cyst is just removed, only the cyst and the ovary is left intact. For suspicious cyst, you may find the whole ovary is removed. Patients who have high suspicion for cancer, you'll find they'll have the cysts, the ovary removed, and sometimes even the uterus. And more extensive surgery is done, especially if cancer is suspected. So that is basically the kind of treatment that you may receive for ovarian cysts. If you're, for example, in the group that is being followed up, where you don't have, you're not going for surgery, or you don't have a cyst that is concerning for cancer, and it is a cyst that can resolve. So in the follow-up period, there are some things we call danger signs, because you need to watch out for torsion. Because if you get torsion, then you need to get to the hospital very fast if that ovary is going to be saved. So if you get acute severe abdominal pain, either on the right or on the left, depending on where the cyst is, on the lower abdomen, then you need to go to the hospital very fast. Sometimes that pain is associated with nausea and vomiting, and sometimes some people have like fainting attacks. So you need to go to the hospital very fast, and then the diagnosis will be made, and then surgery will be done very fast to try and twist the ovary, or the cyst that has undergone torsion. If it is done in good time, then you're able to save the ovary. If there is a delay, then you may end up with that ovary being removed because it's already gotten infected and it cannot be saved. So that is it about this. If you have any questions, please feel free to post them in the comment sections. I'll respond to them. Thank you very much. Let us continue again, Chin, so that at least we continue getting information about different reproductive health conditions. Thank you.